Labrador and across the country. My name is Kathy Dix Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. For today's event, we are joined at the table by Premier Dwight Ball and Dr. Janice Fitzgerald, Chief Medical Officer of Health. The Honorable John Hagee, Minister of Health and Community Services, is joining us via Skype from Gander. Please stand by. Our news conference will begin shortly.
Good afternoon again, everyone, and we will start today's media availability with opening comments from Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media availability yesterday, we have no new cases in the province, and our total number stands at 260, with 242 cases in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% are male. The age breakdown is same as yesterday. 3 people are in hospital due to the virus. Of these patients, 1 is in intensive care. 253 people have now recovered, and in total, we have tested 11,105 people. We are now 2 weeks into Alert Level 4 and have been successful in keeping the number of COVID-19 cases in our province low. This is the result of our collective actions and exactly what we hope to achieve at each alert level. Continuing to follow the public health guidance and orders in place will give us the best chance of remaining in good standing against this virus. As we begin to open more businesses and services, the prevention measures we have so faithfully practiced up to now will be even more important. This means staying home as much as possible, especially if you feel unwell, covering coughs and sneezes, washing your hands often and well, maintaining a safe physical distance from others when in public spaces, and wearing a non-medical or cloth mask when that's not possible. We are all very eager to resume our normal routines and these activities we enjoy, and continuing to practice these measures will allow us to do so. Following consultation with interested parties and further evaluation of the evidence by our public health officials to ensure risks can be mitigated, effective immediately, outdoor tennis courts may reopen, and on Monday, May 25th, pet grooming services may resume, both with some restrictions in place. So for tennis, players using outdoor tennis courts are required to bring and label their own equipment and are prohibited from sharing equipment with others. Individuals must maintain physical distancing at all times, but doubles tennis is permitted with members of your own double bubble. All common areas must remain closed, and further guidance related to the use of outdoor tennis courts will be available shortly on our provincial COVID-19 website. Beginning on Monday, pet grooming services may resume. These operations must ensure enhanced cleaning and disinfection protocols. They must have policies in place to ensure physical distancing and screen for potential COVID-19 exposure. Staff must wear appropriate personal protective equipment, and for detailed guidelines regarding pet grooming services, please visit gov.nl.ca/COVID-19. I'd also like to advise today that limited overnight camping will be permitted when we reach Alert Level 3. Access will be limited to self-contained units, including RVs or cabins, that have a water supply, holding tanks, and personal washroom facilities, as long as they are located in an area with at least 30 feet between occupied campsites. Tent camping will not be permitted in Level 3. Campground owners should have policies in place to ensure physical distancing recommendations are maintained and offer contactless services where possible. All shared facilities such as washrooms, showers, cookhouses, playgrounds, and clubhouses must remain closed. Campground owners will also be responsible for developing communications plans to ensure campers are aware of the rules and preventative measures in place. Further guidance on these requirements will also be available shortly on our provincial COVID-19 website. We are constantly reviewing the public health orders in place, and every decision we make is done so carefully and deliberately with the public's health and safety top of mind. We know how important it is for people to be able to partake in as many services and activities as possible as we navigate living with COVID-19, but we must be confident that we can do so safely. As a recap for those who may have just joined, we have no new cases since yesterday's media availability. The total number of cases in the province remains at 260, with 242 cases in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenville Health. We have now seen firsthand what we can accomplish by working together, and it is incredibly uplifting to know that in this time of adversity, we continue to support one another despite individual challenges we are experiencing. Throughout this pandemic, I have been heartened by the compassion, commitment, and sense of community we have relentlessly shown. It is a testament of our determination and spirit and to who we are as a province. We have already come so far, and we will get through this together. Hold fast, Newfoundland and Labrador, and have a good weekend. Thank you.
Well, thank you, Dr. Fitzgerald. And good news to report again with no new cases, of course. Always good to hear that news for Newfoundlanders and Labradorians. Also some good news for those tennis enthusiasts and people that were looking for some changes in pet grooming. Also for those interested in camping. So this is so far a good news Friday for this table. So let's keep it up. We know the measures are working, but as been mentioned, we must remember to continue to follow the health guidelines if we want to see the successes that we reported today, especially as we head into another weekend. And I think all of us know that as people that participate at this table level, we've always stressed the message over and over again about following the public health guidelines. This is, of course, critical as we stop the spread of this virus. We know that it still lives amongst us, and we see reports coming out from Central Canada today and other provinces. So we must know that even though we're seeing some changes, we cannot be complacent. We must continue to work together to keep COVID at bay as we continue to work with you to support residents and businesses within our province. We know that our business community has faced some significant challenges since the onset of COVID-19, and we will continue to work with them, listen to their concerns wherever possible. We will facilitate processes that will help them carry out operations as best they can during these changing and unprecedented times. An example of this today was the announcement by Minister Osborne that he made this morning that involved a number of supports that will help ease pressures of local businesses. It's about deferral and waiver of some fees, total amounting up to $6 million. The steps will reduce the regulatory burden that business often have to carry. So what this comes down to is further easing some of the operational pressures that faces businesses. It also frees up some cash flow for them. So to dig a little deeper into what's included in today's announcement, there's effective immediately the collection of workplace NL assessment from employers has been deferred after August the 31st with no interest or penalties. This is something that employers have to report to normally in normal times on an annual basis. Clearance letters will continue to be provided during the payment deferral period. These letters, of course, are important for, as an example, for contractors to continue to bid on work and to operate. Of course, when contractors can work, it means Newfoundlanders and Labradorians have jobs. It means people can get back to work when it's safe to do so. The interest-free payment plan for workplace injury insurance, that's extended until March the 31st, 2021, providing employers with more flexibility to pay. For those that are interested in safety training certificates, if they're expired, they've been extended to August the 31st. As an example, this would be people that would be looking for fall protection certificates or confined space entry certificates. This applies to many of our skilled trade workers. This is a certificate they often are required to have, so you won't lose your job because your certificate has expired. We also announced today some rebates or elimination of fees in a variety of areas like aquaculture license fees, as an example. Crown lands often applies to aquaculture sites, so these have been eliminated or waived in these areas. A full rebate for the base of fish processing and buyer licensing fees. So this is the elimination and rebate of these fees will help the fish harvesting or fish processing sector. If you're a real estate salesperson or an agent or a mortgage broker, if you work with an insurance company as an example, or if you're an insurance adjuster or an agent, representative or brokers, we want to let you know that if you didn't renew your license, you don't have to worry. It will not be canceled, and you'll be remain in good standing until the public health restrictions are lifted and you're back to your normal regular business. In addition to that, new license applications will continue to be processed during this time. We also know that we have a number of businesses out there that would have registered, multiple vehicles that are not being used. You are eligible to have this portion of your vehicle registration fees refunded. We have deferred the requirement for businesses to file annual returns under the company and deeds online payment filing fee. So these are a number of examples that businesses would have to go through on an annual basis, and seen some changes there to support them. Also about water use charges in 2019 for businesses like wineries, microbreweries, in the aquaculture sector. They would have been due in the 2020-2021 fiscal year. They have also been waived. Additionally, in June of this year, something that I know businesses and even clients that use businesses often refer to as red tape reduction. So we'll be putting a portal in place for businesses and clients as well to provide information and feedback. That portal will be open in June. This is a useful tool for our work going forward in allowing businesses to suggest opportunities to ease regulatory pressures, especially as we transition into what will be a new normal of doing business in our province. We also know that businesses are the drivers of our economy and employers of many Newfoundlanders and Labradorians, and we need our local businesses to be strong. That's why we will continue to work with them and find ways to ease some of the operational pressures that they face, and help them overcome some of the challenges that they are facing, in many cases with no revenue or severely or significantly reduced revenues at this time. So it is our hope today that the options that we have announced today, which is in addition to the broad suite of initiatives that we've already actioned, will provide a greater level of relief for our provincial business community. I also mentioned yesterday about a business response team, and it's an important resource for our business owners. That's a team that is set up specifically to help answer questions from our business community. Now, to put that in context, we have our public health officials that are led by Dr. Fitzgerald. They're putting measures in place, or in some cases, like today, relaxing measures from a public health perspective. But the business response team, they are available to provide businesses and employers with the information and the advice about operating in the context of this pandemic. As you know, with any discussion, that can often lead to further questions. So this business guidance team, they work directly with businesses to determine where they fit within the alert levels, as we move from alert level 4 to alert level 3, where your business would fit into those different levels. Now, they will also direct business owners to various resources and guidelines. Of course, this helps protect workers and the customers that would visit their businesses. So if you own a business, if you manage or run a business for someone else, or you're an organization in this province, this business response team is there for you. You can reach them by telephone, 1-833-771 or 0696, or you can email your inquiries to covid19info@gov.nl.ca. So there's a lot of work that's being done as we plan and move towards a new normal in our province. We've put in place a number of supports to help you along the way. And we must remain optimistic about reopening our economy and focus our attention on how we can best do it safely, which in turn supports the residents of Newfoundland and Labrador. Now, we know that businesses are core to every community. These are the people that provide donations and supports for many community groups. And as we talk about putting supports in place for them, they have a great new support in place for you. It's a website that's called the Neighbor Good, and that's an initiative with the St. John's Board of Trade and 11 other partners across the province, and there's room for more. So I know many of you have been adapting to online shopping. I hope local online shopping, and there you can get home delivery, you can get curbside pickup. So think about supporting our local business community. So if you have a moment today after the briefing, check it out by visiting the neighborgood.ca, and let's support some local businesses. So as we head into the weekend, you can expect the same routine of news releases. On Saturday at 2 p.m. we will put out an update. On Sunday, likewise, 2 p.m. we will put out an update. But starting on Monday, you'll see the panel here at this table change a little bit. We'll be moving to 3 days a week for COVID briefings. So we'll be here on Monday, Wednesday, and Friday at 2 p.m. And on Tuesday and Thursday, we will provide the updates like we've been doing on Saturdays and Sunday. So if you're wondering why that we've been doing this, this is a decision about balance, about balancing the time for all the priority areas. It allows us to continue to provide information from this table, but by news releases as well. And lets us provide the answers, questions about the pandemic in this usual format. But also there's a big focus on about time management of our public health officials. So this is a consideration of the workload that has increased with them as we open up our province and our economy. So this will give them the time to do the important work that as we start operating in what will be a new normal for Newfoundland and Labrador. Now, if things change, we start seeing a increase of positive cases, we will quickly be back at this table on a daily basis. So what this comes down to is, as I said, some time management. It is about working for you and supporting you through this pandemic. This is not a single, these changes are not a single that this pandemic is over, but it is how we will learn to live with COVID-19 in our province. So if you have any questions over the next few days in regards to the alert level systems, resources and supports both provincially and federally, visit our COVID website. It was created for you. And go there. It's an easy go-to format where you will find the information. And when we are not here on a daily basis, this website will be regularly updated. So keep up the good work over this weekend. Maintain physical distancing and keep washing your hands, as Dr. Fitzgerald has often said. And if you can't practice safe physical distancing, make sure that you wear a mask, especially in higher populated areas or in congested areas. Remember, it's just not about your safety, but it is about the safety of all those around you. So let's keep working together and protecting each other, and we will continue to get the results that we've seen in the past few days. So with that said, I will now turn it over to the Minister, Minister Heggie, for his comments today.
Thank you very much, Premier. Well, it's day 75, and we've got 14 or 15 days now of zero. And who'd have thought no change would actually indicate significant progress. So well done, Newfoundlanders and Labradorians. It is you who has got us here. The vast majority of you have listened to Dr. Fitzgerald's guidance and orders and recommendations. So well done. Interestingly enough, yesterday, a presentation at the House of Commons Committee on COVID-19 was made by a world-renowned epidemiologist, and he said, we look around the world for successful responses to this pandemic, but we can also emulate best practices in our own country. Colleagues in Newfoundland and Labrador control COVID-19 rapidly, and they tell us how to be proactive. So well done, Dr. Fitzgerald and her team, for their leadership that's taken us through these 75 days, and longer for Dr. Fitzgerald, because I know she didn't just start then. It's another example of how the healthcare system in this province is actually leading the country. It's not perfect, and it's certainly not an excuse for complacency. But I think it's another occasion when we can just step back and say, we actually do things well, and we're very bad at showing others what we do well. So well done, Dr. Fitzgerald. Questions that have come to me recently have been around the changes in the regional health authorities to bring up our level of planned activity to deal with less urgent cases. Urgent and emergent cases have been managed on an ongoing basis, and we've shown that by our bed occupancy figures and these kind of things. We are getting more people into hospitals slowly. Our concern around this is always around the PPE that we would need to be able to do that. The decisions about who comes in and what treatment they get is, as always, a clinical one. So for those of you who've reached out and said that they feel that they have been overlooked or that their clinical situation has deteriorated, I would urge you to go back to your first point of contact, your primary care physician or your nurse practitioner, and get them to reassess matters virtually, if possible, or in real time if need be. They are your advocates with the specialty community, and that discussion between primary care provider and specialist determines the priority. It's not an administrative decision, it's not a political decision, it's a clinical decision. It always has been, and that's where it should really rest. We've done very well with virtual care of the clinics that have been deferred through Eastern Health, for example. A full 25% of those visits have been performed virtually. And today, NLCHI, the Centre for Health Information, has launched a new web portal for both healthcare providers and patients based around virtual care to explain to patients how best to access it, but also to help physicians who want to get into that realm to do it or to support those who are already there. So that's another tool in bringing our healthcare system another step forward to a new way of life, adapting to COVID. Again, if you have concerns about other non-COVID related health matters, 811 is there to deal with it. Your regular healthcare providers are there virtually and in FaceTime and in face-to-face time if that is necessary. So again, we're nearly at the decision point for going to alert level 3. I think it's important that, as Dr. Fitzgerald says, we hold fast, we hold the line, and we hurry slowly to make sure we do not trip or fall on the way. So the key has been distancing. The key is your bubble, bigger as it may be now. It's to protect that, and it's to respect other people. And I think if we continue to do that, we will continue to see progress in the form of a line of zeros. So again, have a good weekend, and I'll turn this back to the Premier for the rest of the event. Thank you very much.
Well, thank you, Minister Higgy, and you're correctly and rightfully pointed out the leadership that was mentioned yesterday to Dr. Fitzgerald and her team. But likewise, I think I want to send a compliment out to you as Minister too, who is leader of our Health and Community Services Department. So it's a great team effort, and I want to join you in thanking Dr. Fitzgerald and her group for the leadership they have provided during this pandemic. So with that said, I will now turn it over to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press *1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. This call will end at 2:59 p.m. and any further questions can be emailed. Our first questions today are from Marie-Isabelle Rochon of Radio Canada. Please go ahead.
New Zealand's Prime Minister is recommending a compressed work week as a way to encourage more weekend travel within the country. This idea also has been welcomed by some politicians in British Columbia. What does your government make of this idea?
Of a compressed work week?
Yes.
Yeah, so it's, obviously is something that's been discussed in our province and has been implemented by, some of the public sector workers in Newfoundland and Labrador many, many years ago. So right now is with the number of, with the travel restrictions that's been put in place in Newfoundland and Labrador, just like every decision that will be made, it's done through a risk assessment analysis. Of course, we want to make sure that we can do things safely. And when we get into a position later on this summer, hopefully, if conditions are right in making those decisions, we will put a staycation, program in place for Newfoundlanders and Labradorians. And what days they decide to travel on this, many of them are shift workers now, as we know. So it is not the same in every single province, but the whole idea of having people and giving people the freedom of moving around their province when it's free to do so. We work with our public health officials, and if we're in that position, of course, these are things that we can consider.
But is your government in favor of the compressed work week or not?
Well, from a public health, from a public sector workforce, we've had compressed work weeks in place, many, many years ago for some workers. So this is not something that we would say no to today, but it's not something that we're considering at this time. It's right now it's a focus on making sure that we can appropriately move from level 4 to level 3, and then from a business and a tourism aspect of it, we're looking for putting supports in place to safely let Newfoundlanders and Labradorians move around this province at any day of the week.
Thank you. And I've been talking this morning with owners of Airbnb, not Airbnb, sorry, of bed and breakfast, or registered bed and breakfast, who they feel totally forgotten. A lot of them will not open this summer They feel that they will not be able to pay their electricity bill, their tax bill, even if they are closed this summer. What do you have to say to that?
They are not forgotten. We'll be working with the accommodations and hospitality, Newfoundland and Labrador, the tourism sector in general. And we know right now that it's getting time that we must be ready to show our supports. Some of them have felt, simply because of the magnitude and the size of their business, that some of the federal supports do not necessarily apply to them. Some criteria changes that we saw last week will allow some of the very small businesses within the tourism sector to now apply. ACOA has been getting involved, as well as some other groups around the province as well. And the provincial government will be there to support them also.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I have a question here that was sent to me by a concerned Newfoundland and Labrador physician that I will read out. It says that is the goal of the current public health measures keeping the curve flat in order to maintain healthcare capacity to deal with a potential surge in COVID patients, while also continuing to treat other medical conditions and learning to live with COVID-19 in a way that does not continue to shatter Newfoundland and Labrador's livelihoods? Or has the goal now changed to avoiding COVID-19 infections at all costs until a vaccine is available, no matter how long that takes or no matter how deleterious the socioeconomic and health effects? I'm wondering for your response to this.
Well, I will begin, but I think any three of us that sit at this table on a daily basis would recognize the fact when you just look at the alert system that's been put in place, and by the way, which has been recognized as a good system, one of the best in the country, and that it is exactly titled to that. It's learning to live with COVID-19 until we get to a point where at level 1, where there be the vaccine would be in place, safely in place. So right now, the foundation of this alert level is all about living with COVID-19 in our province, and it's the foundation of how we do that. So this alert system is all about that as we adapt and adjust to living with COVID-19 within our province, and as we open up our business and our economy. This has been clearly outlined in every step along the way here. I think public health officials has done a really good job in putting this out there concisely, and we now have a business response team in place too to support this group.
I think from a healthcare system perspective, in terms of capacity, there is always going to be a need to be able to react to a resurgence of COVID numbers. We've had the discussion on many occasions about the issue of a second wave or subsequent waves. It's coming, and we need to have that capacity there. In terms of progress, and how great that surge capacity needs to be. One of the things that's figuring at the moment, we know, is the issue around people from outside the province coming in. Because if we get through this next week or so and get to alert level 3, really and honestly, the only way we will get the virus is if people bring it in from outside. With the spectre of a court case and potentially losing the ability to control our borders, our only safety net at that period would be the empty beds we have in hospital. And if we fill them with patients who require planned procedures, and I'm not saying we shouldn't, if we fill them, it takes 3 weeks to vacate those beds. We can go from 0 to another cluster in less than 2. So we've got a challenge there.
Minister, in response to that, though, when we look at the numbers that we have had in hospital, at no point could our healthcare system not support the first surge that we had. So in that, I guess the argument back to it is we've had more cases of the flu in the hospital. So how do we balance this?
We did very well, and it goes right back to that comment from Dr. Fisman in the House of Commons Select Committee. From a public health point of view, Newfoundland and Labrador was fast off the mark. It had better than a 90% hit rate with good old-fashioned contact tracing. And we fought that cluster. Fitzgerald's team fought that cluster to a halt. The evidence from subsequent waves and second waves in other countries and from history is that they hit harder, they hit faster, and they are worse. There is no playbook for this. And on the one hand, we have, no cases. And on the other, you have projections from well-respected epidemiologists that show that if we do not have capacity, we will run out of the ability to look after sick patients very quickly. You saw the PHAC and the CHI projections of what would happen if we slip with social distancing, even the slightest bit, where we run out of ventilators and we run out of ICU beds. Those are potential futures. And my job, our job in the health department is to hope for the best but plan for the worst.
Kellyanne, the minister.
My final question. Oh,
sorry. The minister's right, because he correctly points out how important to control our borders is. As we look around the country today, we would see that places, other provinces, that if you're a Newfoundlander and a Labradorian, if you're driving to Newfoundland and Labrador, or even if you're flying to Newfoundland and Labrador, these are provinces that we must go through. And they are trending upwards today in positive cases. So, we sit here and we announce zeros and no positive cases in Newfoundland and Labrador. We can't be complacent but we must be mindful of what's happening around us. And as the minister points out, if we have to respond to a flare-up or a setback, we must make sure that our medical system is there, our health system is there and able to respond.
Thank you. I don't know if you saw the federal briefing just before this, but in it they said that the Atlantic provinces and territories are in a better position to jump on their health backlog because of the measures in place and because of the low number of active cases. Minister, you've spoken to needing PPE. What level or how much PPE do we need to ramp our services up ahead of the second wave?
The short answer and glib answer would be more than we've got at the moment. Our deliveries are late and light, and that has been a consistent feature since we put in our orders in January of this year, well before COVID actually arrived here. Our challenge, in actual fact, around doing more in terms of elective surgery at the moment is not beds. The RHAs would feel comfortable with a 75% occupancy rate. As of this morning, it is 62%. We have a margin there we could use. The challenge in doing that is we are going through PPE for non-COVID related cases because of new recommendations around infection and prevention control way faster than we would this time last year. So until we get some security of supply or local suppliers get their product certificated and can start producing volume, we are on an almost weekly calculation as to whether or not we should do more or could do more.
Thank you.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
You touched on it a little bit just a moment ago about the Supreme Court challenge to the province's travel ban, and that's happening on Tuesday. What's government's response to that?
Well, right now, this is a thing. This is obviously this is in the courts right now, and through Justice and Public Safety and with the Health and Community Services, there will be a response when it's appropriate to do so. So, as I've mentioned, this travel ban was put in place to protect Newfoundlanders and Labradorians from the spread of COVID-19. And I think the importance of this, as the Minister and others have clearly articulated, is important for us. It was the reason why it was implemented there, to make sure that we had the proper enforcement measures in place. So, we'll let the court proceedings, do its thing, and we'll respond appropriately.
And if a second wave is being predicted, aside from capacity and PPE, how else is the province preparing for it?
Well, the healthcare system is, as the minister just clearly pointed out, is making sure that we have the amount of PPE. This would be critical. Other thing that's important is that if indeed we do get a flare-up or a second wave, as been just mentioned, making sure that we have, contact tracing in place. We've done a real good job with contact tracing with the flare-up that we saw in late March here in Newfoundland and Labrador. So these are measures. Tighter borders is important for us, making sure that we have the capacity within our healthcare system. But PPE is an important, component of this, making sure that we can respond.
Okay, and medium-risk outdoor recreational activities can resume during the upcoming alert level. What does that include and exclude?
So that really is part of the consultation process that we're going through now with some of these sport organizations. So we're thinking outdoor field sports, perhaps done differently than in some ways than they have been previously done before. But it's basically if if it can happen outdoors where we know the risk of transmission is lower, with physical distancing respected as much as possible, and taking into consideration spectators and shared facilities and things like that, shared equipment. All of these are things that we have to consider when we're talking about what types of activities can resume.
Thank you.
Our next questions are from Meg Roberts of CBC News. Please go ahead.
Today, tennis, dog groomers opening. The conversation yesterday was to hold fast for the next level. So what has changed?
I think the conversation has always been around making sure that the public health officials had the appropriate amount of time that was required to do the risk assessments, to make sure that they met with the organizations. And this is one of the reasons, as I just mentioned, as we move into alert level 3, is making sure that the public health officials, they have the appropriate amount of time that's required to make those decisions. Fundamental and underlying all of this is that you do this safely to protect not just the workers there, but also the people that would use those services. So these are the decisions that come out of public health, not politically driven at all, but making sure that public health officials are given the time and the ability to make the decisions based on those particular operations.
Minister Haggie, there are other fertility clinics across the country that are open. So, if people can get their hair and their nails done, why can't they get fertility services, especially given the fact that the clinic is outside of the hospital?
In actual fact, the entire service is outside the hospital, Meg. It's a difficult situation. I appreciate that. In actual fact, there's only one clinic that I'm aware of that is open, and that is partially open, and it's in Calgary. Halifax is still closed, and the Ontario clinics that I'm aware of are closed. As I say, these are all private facilities. The Newfoundland and Labrador Fertility Service is supported by Eastern Health and has been providing a limited range of services throughout COVID, in actual fact, according to information I have supplied from Eastern Health as of this morning. So, again, that goes back to the clinical decision as to what is time sensitive from the point of view of treatment, and that's a clinical decision. Obviously, I have no control and very little insight into what goes on in other jurisdictions, but we have an expansion plan, a resumption of normal. Eastern Health have discussions with the clinic about when they're going to expand the range of services that they've already been providing, and I would imagine that they will be making some announcement about that over the course of the next week or so.
Testing is, we are told, one of the keys to stemming the pandemic. Yesterday, the Prime Minister announced that the federal government will help the provinces scale up testing and contract tracing. And last night, during his call with premiers, he re-emphasized this as a priority. Have you agreed to the funding, and what would that look like here in Newfoundland and Labrador?
Well, thanks, Megan. Certainly that was part of the call with the Prime Minister and other premiers for the last couple of weeks now on what a national testing strategy would look like. And that's varying. It's also around serological testing that would be for Canadians as well. This is a federal program, a federal responsibility, and a federal cost. So really no negotiation on funding. The Prime Minister has clearly pointed out that this would be borne by the federal government, the cost to do this level of testing that they're talking about from the federal government.
Thank you very much.
Our next questions are from David Marr of The Telegram. Please go ahead.
Yes, I'm wondering a question with relation to vacations. I know that there's been no explicit ban on interprovincial travel, but I'm just wondering if you could offer some more clarification on interprovincial travel, and as well, sir, a secondary question in terms of accommodations reopening, hotels and motels and whatnot. Are there plans for public health officials to visit those sites and ensure that they're complying with guidelines?
So I think there was the two questions that I heard there. One would have been how you move around the province using the local airlines, and that was, of course, we want to still ask for Newfoundlanders and Labradorians to travel only when necessary. From the accommodations point of view, this is something that we're working on now with our Cabinet Committee on Jobs and recommendations that we see coming out of Hospitality Newfoundland and Labrador. What services, how can we support them? Any service that we put in place or complementary measures would be indeed complementing, what's available from the federal government. So moving around a province, essential travel, or limit your travel as limited as possible, because we still know that this virus is within our community, but we must do so safely. We also know that people are looking to see the ability to move around, but when we'll take the advice from public health officials on how on what measures would need to be relaxed to allow that to happen.
Dr. Fitzgerald, do you have any comment on that front?
So with regard to traveling, obviously we do have to take into account our situation, and we've been encouraging people to try to stick as close to home as possible, and certainly while you're traveling to stay within your bubble, and to limit your contacts with people outside of your bubble as much as possible, because we know the more contacts you have outside of that bubble, the higher the risk is of either contracting or spreading COVID-19. So, all of those public health measures that we've recommended up to now, with physical distancing and washing your hands and staying in your bubble, those all still apply regardless of what kind of travel you're doing. And, hotels and motels were not closed. The reopening or people traveling and staying in those areas, obviously guidelines will have to be in place for how that can happen safely.
Thank you. Ontario says that they're going to be releasing a plan for random testing of their population sometime next week. I suspect this might be kind of tied up with the federal conversation in one of the previous questions there. But I'm wondering, what is the plan for random testing in this province? Will we see that with alert level 3, 2, 1?
So we have to be careful with testing. You have to know what question you're trying to answer when you're doing the test. To do testing just for testing's sake is not really a good idea, nor is it recommended. So we know that we have a low prevalence in our population right now, and we know that the risks of having false positive tests go up when your prevalence is low. So you have to think about what the potential unintended consequences will be of testing large numbers of people who have a low risk of disease, because you could end up with false positives. Then you also have to consider the false negatives. We have, none of these tests are perfect, and we know that there can be up to 30% false negative rate with these tests. So that's something you have to consider, because that sense of security that can come with having a negative result may relax somebody's attention to some of these public health measures that we've been recommending all along, that we know works to reduce the spread. So you have to be careful about that. And if you have somebody who is a false negative, they could be spreading disease and not realizing it. So we need to have a question that we want to answer by doing that type of testing. And, we certainly, as we go forward, we will develop a testing strategy. And as we if we have to contend with a surge, a second wave, and we start to see an increase in prevalence in our population, then the value of such testing may be higher in that situation.
Thank you. And I think this flows into my next question.
You've asked 3 questions already, so we're going to move on now to single questions, starting with Marie-Isabelle Rochon of Radio Canada. Please go ahead.
Going back to my question regarding bed and breakfast owners, again, I talked to some people today. They were saying that they are going to go away this summer. They're going to work in another province because they don't qualify for any federal help right now. Their only way of making a living is to go to work in another province in their tourism industry. What's your reaction when you hear that kind of story?
Well, as Dr. Fitzgerald said, the accommodation sector for bed and breakfasts, they have not been closed up. This is really about people that have not been moving around because of this virus, which is the same in many other provinces, by the way. So right now we're working with Hospitality Newfoundland and Labrador, and we'll be ready very soon to actually make an announcement on how we support the accommodations industry within our province. There are very few people that have not been able to qualify for the criteria based on what's been out there by the federal government. There's also been some loan mechanisms that are in place by ACOA to help them bridge them through this very difficult time with a premium at the end, a portion of that loan to be forgivable as well. So there's a lot of federal programs out there. There's some provincial support coming, but in some situations, maybe there's examples of there's just not enough there for people, and they will look at other options for them. But our job is, what we want to do as a province is keep as many of those B&Bs, those accommodations, in place as we get through this health pandemic, that when we see people back visiting Newfoundland and Labrador in a safe manner, that they are there to supply what has been some great experiences for visitors from coming out of our province.
But you've been saying that help was coming.
It's a single question, Marie Isabel. We have to move on to Kellyanne Roberts of NTV News. Please go ahead.
I know it was asked earlier this week in terms of some of the guidelines for the double bubble and summer camps and things like that for level 3. Wondering if we're any closer on some of those guidelines being made public.
We're certainly working on those. Our team is, very diligently working on developing those, but obviously it will take some consultation as well. So we need to know how many of these businesses work in order to be able to help them, or to develop guidelines with that in mind. So we will have them up before level 3, but they're in the works.
Thank you.
Our next question is from Tyler Dunn of VOCM News. Please go ahead.
I know we've talked about this earlier last week and a little bit before, but are we any closer to knowing the probability of an Atlantic bubble being implemented?
So the Atlantic bubble is something that gets, discussed, on a really a bi-weekly basis with our Atlantic premiers. And, your province has to be right to be able to do this, to do it safely. So there's been no discussions with any Atlantic Canadian province right now to see where there would be a date. As been mentioned, as we move from one alert level 4 to 3 to 2, and the system that we have in place, we must make sure that first and foremost, that we can travel around our own province within Newfoundland and Labrador safely. That's the first thing. Allow for the information and the monitoring, the incubation periods of this virus, allow that to occur, get the necessary feedback before we start expanding and relaxing the travel restrictions to another province. So, it's an interesting discussion. There's some good results around Atlantic Canada, has been mentioned already today, but we will take this very slowly and cautiously, making sure that we can travel around our own province first.
Thank you.
The next question is from Meg Roberts of CBC News. Please go ahead.
The Minister made himself available to the media today because of the grave economic situation. Can you further explain why your minister responsible for the status of women is avoiding interviews about domestic violence during the pandemic? Why don't you invite her to attend the briefings next week?
Well, she can, she's the minister. All our ministers, by the way, are available to the media at any time. And I think, CBC and NTV, and I think VOCM has reached out. I think there's some media plan for this particular minister next week as well. We've had various ministers that would be out there publicly speaking on behalf of their departments. I think it's not about who participates at the panel, is what services are in place. And I think the real issue here today is that we do not want to leave women in our province feeling that there's no measures, there's no help available to them. There is services available to them. We've clearly outlined them, through these panel discussions, and we know from media outlets, from transition houses and so on, from the Department of the Status of Women, that there are supports in place. We have with the RNC, this department working very closely. This is a policy-driven department right now. They participate on all the committees that we would see within government on decisions around social and economic policy. So this is a very small but a very busy department that's working, and they are available. The minister is available to the media and has been available to the media this week. So right now, as all our ministers are available, I encourage you to reach out if you have questions.
The next question is from David Marr of The Telegram. Please go ahead.
I'm wondering, I understand that there's privacy concerns in terms of discussing individual cases, but noting the one case that's in the ICU, they seem to have been there for quite some time. I'm wondering, is there anything that public health officials, are learning about this disease in light of this particular case?
So I don't have information regarding each individual case. That's not really public health's job. That's the job of intensive care physicians and other internal medicine physicians. And I'm sure that those people are learning every day from that particular patient. But as to the direct information of an individual case, no, we wouldn't have that.
Thank you, Dr.
One of the things, David, sorry, I'm cutting you off.
I know you can't see me, so go ahead.
David, I think one of the things it does speak to is data from other jurisdictions that shows that for patients in intensive care, their stay in hospital can actually be quite protracted in the intensive care phase. And it's another calculation that you need to have in mind when you're working out demand and supply of beds. Because if one individual is going to occupy an intensive care bed because of COVID-related issues for 3 weeks, that has significant implications on bed availability too. So it's a challenge because then people criticize you and say, well, you've got all these empty beds here. What are you doing about sick patients? And the answer is it's a balance. There is no playbook for this. But it shows you very clearly that this, for some people, is not a disease to be trifled with. And it presents a major challenge because we're still learning about it.
Thank you, Minister. We'll now take 3 quick questions before we sign off for today. So, operator, please advise who is the first reporter.
Thank you. Kellyanne Roberts with NTV News. Please go ahead.
Thank you. We knew earlier the week, maybe last week, the days are almost together at this point, but antibody testing was being validated here at our lab. Wondering where we're at with that.
That's still in process, as far as I know, the latest information I have. We are still looking at how these tests can be used, and there is an FPT group, a federal, provincial, territorial task force that's actually looking at the best way to use these types of testing. And so we'll certainly be waiting for further information from that group to inform how we use that test. But yeah, our lab is still in the process of validating those.
Thank you.
And our next question is from
David Marr with The Telegram. Please go ahead.
Thank you very much. Once again, I have a question here relating to obstetricians and their ability to see postpartum mothers. I'm wondering, my understanding is that they have not been deemed essential services. I'm wondering how available are obstetricians to mothers who may have just recently given birth?
I think you've got to bear in mind that from an obstetric point of view, I don't know how you would not call them essential. It seemed a bit of an odd descriptor. The decision as to whether or not an obstetrician needs to see a patient and examine them is entirely down to the physician, and has never been taken away from them and never should be. So how that is organized is something that should be done in the light of COVID. If these individuals are currently inpatients in a hospital and the obstetrician who delivered them has privileges there, then really and honestly, I'm not sure I would see any issue with access at all.
Thank you very much. And if I can say happy birthday, Mom.
Thank you, David. Our next question, please.
It's from Meg Roberts with CBC Newfoundland and Labrador. Please go ahead.
Seasonal residents are going to be allowed to visit their summer homes in PEI starting June 1st, as long as they get pre-approved by providing travel documents, proof of property ownership, and a written plan on how they will self-isolate. PEI trusts them to follow the safety measures. Why do you not trust that seasonal residents of Newfoundland and Labrador will do the same?
So for travel restrictions within Newfoundland and Labrador, matter of fact, I had this very conversation with the Premier Prince Edward Island just the day before yesterday. So, they're putting in some travel restrictions, and they're going to allow some certain residents that would have been, coming from, I guess, other provinces within Canada, as we know that international travel has been restricted and for at least another month. So, for us right now, is we've made a decision here in our province to speak about and relax some of the measures around traveling within our province. We see that as a first step. Any decision that will be made on that will be done with the support of the public health officials through Dr. Janice Fitzgerald. So right now, we're comfortable with where we are. We recognize that there's a lot of people that would own property from outside our province that would enjoy coming to Newfoundland and Labrador, but our situation is a little different. And so right now that, we put those alert levels in place that do not include people traveling for extended stay coming in our province. But you know what? These are things that you'll consider as we move through the alert system. And as we've seen today, there's been changes based on the information that's been provided. But right now, the decision stands. And, we'll deal with traveling around our province as opposed to people coming from outside Newfoundland and Labrador to visit their seasonal properties. We just need to look no further than what's happening in Ontario today, as many of those people would be residents in that particular province, to see the level of exposure that we're seeing there today.
Thank you.
Thank you very much. The time for questions has ended. Please join us again on Monday, May 25th at 2 p.m., 1:30 in most of Labrador. Have a great weekend, everyone, and if you can go camping, go for it. Bye.